Alright guys and girls, it's jerninghgam here. The figures in Scotland for Minister Nicola Sturgeon says 28 new COVID deaths related in the nation took the total of deaths in Scotland to 2,877. I'm going to show you here. This is Nicola Sturgeon speaking. I can't really focus properly on there we go, the screen. So if you do live in Scotland and you are in an area, what you do know what the numbers are. I'm trying to find the numbers for the UK today. I can't seem to see them anywhere unless you guys and girls know where the numbers are. But this is just the Scotland update of what numbers that are here. What Nicola Sturgeon is saying. She says she thinks the virus is dropping in Scotland, which is very good news apparently. But we shall have a listen to see what she says and go through what she says. Don't we? So let's play what she said. Oh, just a minute.
Praise the move, but the
1 second, I've just found the deaths. Have I found the deaths? Praise the mood. No. Thought I found the deaths then for a second. Right, so we're going to do Nicola Sturgeon speaking about Scotland. And hopefully we're going to find deaths for the UK at some point today. Unless I've missed them. Right.
Thank you for joining us. I will start with today's statistics as...
She's going to talk about the deaths now because I've just done it in front.
The number of positive cases reported yesterday was 999. That is 10.3% of the total number of tests that were carried out.
This is in Edinburgh, Scotland, if you live there.
The number of confirmed cases now to 67,011. 378 of new cases were in Greater Glasgow and Clyde, 207 in Lanarkshire, 128 in Lothian and 107 in Ayrshire and Arran. The remaining cases were spread across 8 other health board areas. I can also confirm that 1,254 people are currently in hospital, which is an increase of 29 from yesterday, and 92 people are in intensive care. That is 1 fewer than yesterday. Finally, I regret to say that a further 28 deaths have been registered in the past 24 hours of patients who first tested positive over the previous 28 days, and that means the total number of deaths under the daily measurement is now 2,877. That obviously reminds us again of the heartbreak that this virus is continuing to cause to families the length and breadth of the country, and again I convey my condolences to everyone who is in that position and who is mourning a loved one. I'm joined today by Shirley-Ann Somerville, the Social Security Secretary, and also by the Chief Medical Officer. Shirley-Ann will talk in a moment about the Scottish Child Payment. Applications for the payment will open soon, and we're encouraging all eligible families to apply. This will be a valuable source of additional support for all eligible families, but that includes many who are struggling right now as a direct result of the pandemic, which is why it is appropriate to draw attention to that. I also want to highlight that later today the Health Secretary is giving a statement in Parliament where she will set out details of our plans for adult social care over the winter, which is obviously extremely important. In my remarks today, though, I want to return briefly to an issue that I covered yesterday, the availability of money from the UK furlough scheme, since there have been some seemingly significant developments since I stood here last yesterday. In particular, the Prime Minister appears to have agreed yesterday that access to the furlough scheme at the higher level of 80% of wages will be available to Scotland after the 2nd of December if that is required. I welcome that commitment, although I do so with, I suppose, a necessary degree of caution. We haven't yet seen any detail of what that commitment means when translated into hard practice. And in particular, we've not yet had confirmation from the Treasury that continuation of furlough in Scotland beyond the 2nd of December would be at the 80% level. We have always known there would be some form of furlough scheme continuing after December the 2nd. That's never been the point at issue. The point is at what level, and we await confirmation that it will be on the same basis, eligibility, and the 80% level that will apply throughout November. Obviously, there has been some doubt cast over the Prime Minister's comments by another member of the Cabinet in a television interview this morning. But notwithstanding that, we still hope that the Prime Minister's commitment will hold and that furlough payments will be available after the 2nd of December on the same terms as they are being made available in November. But obviously, we can't be certain about that until we've seen the commitment translated into certainty by the Treasury, and we're pressing urgently for that clarity. This issue of furlough payments is important. It's very important, actually, for the reasons I spoke about yesterday. First and foremost, it's important for the sake of people across the country who are worried about their jobs and wages. But it's also important for the Scottish governments and indeed the Welsh and Northern Irish governments' ability to plan and steer the best course we can through this pandemic. With vitally important decisions having to be made by all governments day after day just now, it's not helpful for any of us to be distracted by a lack of clarity from the Treasury. And it's obviously far from ideal, as I tried to set out yesterday, if vital public health decisions for Scotland, Wales or Northern Ireland have to be in any way distorted by the need to access financial support that only takes account of the situation in England. Instead, what we want to do and what we are determined to do is continue to follow the careful, cautious, public health driven approach that we have taken so far in Scotland. Not least because it has put us, relatively speaking, with no shred of complacency, in a strong position. We face difficult judgments for the future, and as I say, we have no room for complacency, and I'll return to that point in a moment. But as of now, prevalence of COVID is lower than in other parts of the UK. And that is, we believe, partly down to the plan we have been following, and obviously it is very much down to the sacrifices that people all over the country have been making. So we want to continue to base our decisions on the best evidence that we have, and that's what we intend to do. We will be closely monitoring progress this week ahead of our scheduled review of the allocation of levels next Tuesday. The fact that we acted quickly to control the pandemic in September and October means that we are now, we think, seeing some encouraging signs in the figures for new cases. The last few weeks appear to show the rate of increase in cases slowing down. And that is good and positive. And as I said a moment ago, it is down to the sacrifices all of you have been making. But as we know, day-to-day figures will reflect in part the fluctuating demand for testing and case numbers, and crucially the test positivity rate, you'll see that from the figures I've given today, remain high. So we can't be complacent in any way, shape or form. The situation we face, in common with countries the world over, is a fragile one, and we must proceed with great care and caution. So we will be assessing throughout this week whether we might be starting to see a sustained improvement leading to a fall in the number of new cases, which is what we are hoping for, or on the other hand, whether case numbers are instead reaching something of a plateau. And that's important, and I want to take a little bit of time today just to explain more fully why that is important, and I'll do that with reference to our experience over the summer and so far. The fact is, we can't really take any comfort in a situation where case numbers are continuing to rise, even if they are rising at a slower rate now than was the case a few weeks ago. And we certainly can't take comfort in a situation where case numbers simply plateau, where they stay steady, but at the current high levels of around 1,000 a day. And let me explain that with reference to our experience over the summer. One reason why we might be, we think, in a slightly better position than, say, England is just now, in addition to those early steps we took in late September to start to impose restrictions, is that we did reduce cases to a very low level over the summer. And what that means is that even when the R number started to rise above 1 again, that increase was from a much lower baseline. Had we come out of the summer with higher prevalence than we did, we would probably be in a much more severe situation right now. So that baseline point matters, and it matters just as much, in fact, possibly more so now as we head deeper into the winter period. A high level of cases, even if they were quite steady or growing only slowly, would not be a stable position. It would mean that if the R number was to rise at all during the winter, which with more people inside is quite likely, it would start to drive increased transmission from a high baseline. And that risks the situation very quickly potentially running out of control, and that would mean more deaths and a possible overwhelming of our NHS. So the point I need to stress is this, and it's a really important point, and I'm stressing it just to try to develop the understanding we all have of the factors we have to weigh up over the next period. And the point is this one. We need to be confident, not just that the situation we face right now isn't deteriorating, we also need to be confident that at current levels of intervention, the situation is improving significantly enough. If we're not confident of that, it may be that we can't move.
Nicola Sturgeon confirms on 18 levels beyond the December,
upper level. And while we
to December
not be the case,
beyond.
That analysis also means that we cannot rule
Edinburgh, this is, yeah.
having to move some levels, some
Scotland.
areas of the country to level 4 for a period. Now, we haven't reached those decisions yet. This is a judgment we'll be considering as we assess the data in the days ahead. Now, I'm always aware that when I talk like this, it can fuel media speculation about what's going to happen, and that's understandable. It's the media's job, after all, to try to work out and report what might lie ahead. So that is in no way a criticism. But the view I've taken throughout this pandemic is that it is better for me to try to be open and at times discursive about the factors driving our decisions, so that you understand not just what we're asking you to do, but why we're asking you to do it. So I will continue to try to keep you informed of our thinking and of the factors that we are taking account of as we head towards this first review point of our new level system, which is due next Tuesday. But let me conclude on this point, because it's an equally important one. In the meantime, all of us have a vital part to play in trying to ensure that the situation does improve and that we don't need to impose more severe restrictions. I want always everybody to remember that none of us are powerless in the face of this. The best thing all of us can do, and we all can do it, to reduce the likelihood of further restrictions, is to abide by the rules now and try to limit as much as we reasonably can the contact we are having with people in other households. And abide by the spirit of the rules. As I said yesterday, please don't look for the loopholes. Don't try to put your own twist or interpretation on the rules. If this is to continue to work as we believe it is, although we're not yet sure it's working far enough and fast enough, then it takes all of us abiding by these rules to the letter and in the spirit of them. So let me just finish by recapping right now on what we are asking people to do. If you live in one of the areas at level 3, most parts of the Central Belt and now also Dundee, you should not travel outside your own local authority area unless it is essential. By essential, we mean work that can't be done at home or caring responsibilities. And people in other parts of Scotland, please do not travel into level 3 areas except for the same essential purposes. We are also, and this is important, we are also asking people right now not to travel outside of Scotland, not to travel to other parts of the UK, England, Wales, Northern Ireland, and not to travel overseas, again, unless you have an essential purpose for doing so. Abiding by travel restrictions is essential. Within Scotland, it's essential to avoid us taking the virus from high prevalence areas to low prevalence areas, so that those low prevalence areas don't stay low prevalence areas. And of course, more widely, it's important for all countries as they try to suppress the virus within their own borders to minimise the chances of importing it from other countries. In addition, none of us anywhere in the country right now should be visiting each other's homes, again, except for very specific purposes like childcare, or if you have to look after an older or vulnerable person, or if you're part of an extended household. It's a really, really tough restriction, and I speak from experience when I say it gets tougher with every day that passes not to see close family members. But we know that limiting contact with people outside our own households, inside our own homes, is one of the most effective things we can do to reduce transmission of the virus. When you are meeting people from other households outdoors, which you are permitted to do, or in indoor public places, remember the limits. You should not meet more than 6 people from a maximum of 2 households, again, to limit the chances of the virus spreading from one household to another. Avoid car sharing if you can, work from home if you can, make sure you've got the Protect Scotland app on your phone if you're able to have it. And finally, the 5 key rules that help all of us keep ourselves safe, reduce the risk of us getting the virus, and crucially reduce the risk, if we have the virus, of us passing it on to other people. So remember to wear face coverings, remember to avoid places that have crowds of people, remember to clean your hands regularly and thoroughly, and clean hard surfaces that you might be touching or that other people might have touched before you, and remember to keep 2 metres distance from people in other households if you are coming into contact with them. And lastly, self-isolate and get tested immediately if you have any of the symptoms of COVID. These rules do help us protect ourselves. They undoubtedly help us protect our loved ones and those round about us, but they also help wider communities, and they definitely protect our National Health Service, and ultimately they help to save lives. So let me just conclude with a summary, a couple of sentences here. We are right now in a difficult position in Scotland, but it is not without its encouraging signs. We have to satisfy ourselves, though, that those signs are encouraging enough and going firmly enough in the right direction. So there are some difficult judgments that lie ahead of us, and that will continue to be the case week on week as we go through winter. But all of us have a part to play here. The reason we have these encouraging signs right now is because we acted quickly, and all of you have abided by what we've asked you to do. If we keep that up, then we can be cautiously optimistic that we can continue to see progress through what undoubtedly will be a tough winter, but one that we have to get through and get through together. Thank you very much for listening. I'm going to ask Shirley-Ann to say a few words now before she and Chief Medical Officer take questions from the media.
Thank you, Minister. Tackling inequalities and poverty is one of the Scottish Government's key priorities, and we recognise the economic impact that the COVID-19 pandemic is having on low-income families. That is why we are determined to prioritise the introduction of the Scottish Child Payment. Last June, when the Scottish Government announced the introduction of the Scottish Child Payment as a key element of our Tackling Child Poverty delivery plan, it was rightly described by stakeholders as a game changer. Now it is more important than ever. And I'm therefore delighted to announce today that the Scottish Child Payment for families with children under 6 is opening for applications next Monday, the 9th of November. Given the scale of demand, we are taking applications now. This is so we have all the information to make the payments as soon as possible after the benefit officially starts on Monday, the 15th of February 2021. This is almost 2 years ahead of the original commitment for the full new benefit to be introduced. It is my intention to roll out this payment for all under 16 at the end of 2022. This is subject to the Department of Work and providing the data
the hand
benefits. A
like
timetable
destiny.
of under 18 months from the announcement to the delivery of a benefit is unprecedented in the UK, and I believe this is a testimony to the priority that this Scottish Government has put on tackling child poverty. Now, significantly more families are now relying on benefits due to the coronavirus pandemic, and many perhaps for the first time. Indeed, recent estimates from the Scottish Fiscal Commission now suggest that 194,000 children could be eligible for the payment this financial year. That's an increase of 34,000 children since the pandemic began. The Scottish Child Payment will be delivered by Social Security Scotland and will pay the equivalent of £10 a week per child over every 4 weeks to eligible families who are in receipt of existing low-income benefits. There are no limits to the number of children per family who can receive this benefit, unlike the approach taken to universal credit and the child tax credits by the UK Government, where payments are of course limited to 2 children. The payment, together with the Best Start grant and Best Start Foods, will provide over £5,200 of financial support for families by the time their first child turns 6. For second and subsequent children, this will provide £4,900. Now, we're expecting a significant demand for this payment, which is why we're opening the applications early from Monday, 9th November. and I would encourage all parents and carers who think they may be eligible to apply then. And I'm asking families to help us by getting their applications in early so that we can process and start making the payments as quickly as possible when the benefit begins in this February next year. And I'm very proud that Scotland is the only part of the UK to provide this additional support to children. So I would urge all eligible families to apply by calling 0800 182 2222 or visiting mygov.scot/benefits from next Monday. Thank you.
Thanks, Leanne. We're now open to question. I will go firstly to Ewan Petrie from STV.
Thank you, First Minister. I just wanted to clarify, really, if you don't get the confirmation that you're looking for from the Treasury, do you at a point where you have to make a decision on further restrictions to make the most of this window? For example, could changes be introduced before the first review of the levels next week?
I've decided as of now that we're going to stick, if we can, to our scheduled review period. I think that's probably on balance the best thing to do. If we don't get the commitment translating into practice, then clearly that has implications for the length of time then that we would have access to the more generous furlough scheme. But I cannot base I have a duty to take ordered, rational, as well thought through decisions for the people of Scotland in a really unpredictable and highly uncertain situation, and as I can, and I can't allow myself day to day to be distracted and thrown off course by chopping and changing of positions from the UK government. And you can probably detect a degree of frustration in my voice, and that's because it is frustrating, but I need to focus on trying to take the best decisions. I should insert a caveat here, which is not just about furlough. We never rule out taking quicker decisions than a scheduled review point if the evidence merits it, or if the wider circumstances merit it. If you cast your mind back to last Thursday, I said that Lanarkshire, which we decided on balance to keep in level 3 and not move to level 4, we were looking at that very closely on a day-to-day basis. Now, the situation there hasn't got worse since then, so we don't need to move more quickly at this stage, but we are looking at that on a daily basis. So I'm going to try and stay on a sensible, rational path here. It's in nobody's interest for public health decisions to be distorted by the need to effectively try to game a financial system. We should all have access to the same financial support. Scotland, Wales, Northern Ireland shouldn't be at a disadvantage to England, nor should we be at an advantage. There should be a level playing field there, and I hope we get to that position, and we'll have to see where we get to over the next day or so. But I need to stay focused on trying to take sound and rational decisions that continue to steer a path through this virus. Manny Stewart from BBC.
Thank you, First Minister. Good afternoon. You're live on Lunchtime Live on BBC Radio Scotland. We've just broadcast an interview with a man who contacted this programme some time ago to raise his concerns that vulnerable patients like his dad were being placed alongside COVID patients at Glasgow Royal Infirmary on poorly ventilated wards. He said he raised his concerns with a consultant who agreed it was a, quote, a wicked situation that he couldn't do anything about. His dad then did go on to contract COVID and died from it. So he wants to know why we're putting vulnerable patients at risk in this way, and would you actually be comfortable with your elderly relative being placed in a bed alongside a COVID patient?
Barry, can I say firstly, I want to convey my deepest condolences to the gentleman who you have interviewed on your programme. Anybody who has lost a loved one to this virus has gone through and is going through unimaginable grief. And that will be compounded in any case where a family believes, for whatever reason, that their loved one hasn't had the standard of care that they had a right to expect. So my condolences go to the gentleman and the family. I haven't heard the interview, obviously, and I don't know beyond what you have told me the wider circumstances. So it would be not fair to the family and not fair to the wider public listening to this for me to try to comment on an individual case that I don't know the detail of. I'm going to hand over to the Chief Medical Officer who will say a bit more about how patients are managed in hospitals, but we have asked hospitals since the start of the pandemic to operate what we've called red and green zones, which is about the separation of COVID and non-COVID patients. So obviously I would want to look into why in that circumstance that hasn't happened. I thankfully haven't had close family members in hospital as patients over the course of this.
Now, Scotland's First Minister giving us the latest figures. A further 999 people tested positive for COVID-19 in the last 24 hours in Scotland. That's around 10% of those people who are being tested. So it brings the total number of positive cases in Scotland to 67,011.
From Edinburgh to London, we're going to go live to the Commons, where the Shadow Chancellor, Annalise Dodds, is asking an urgent question. There's the Speaker.
Notice will be given before the House rises the proceedings sitting days or 3 o'clock on a non-sitting Friday. I now call Shadow Chancellor Annalise Dodds to make her urgent question. Annalise.
Thank you very much, Mr. Speaker. To ask the Chancellor of the Exchequer if he will make a statement on economic support available to...
Well, guys and girls, if you want to watch more of that, I suggest you go on to YouTube and watch it, or you can find somewhere else to watch it. Like I say, I'm trying to find the coronavirus numbers for the UK today, but I can't seem to find them. But anyway, this is Nicola Sturgeon's speech in the video. Thank you for joining me. And me joining him here. And see you in the next video. Thank you for joining me now. Hit that notification bell, don't forget, and give me more likes. If people dislike the video, I still get the likes anyway, so thanks for joining me. Peace.